using robots quite frequently, and this, I think, now brings us to the most up-to-date modern sort of technology that's out there. This technology, I believe, is here to stay, and what the robotic technology does is it allows those pieces that I just showed you the pictures of to be placed in the knee or the hip with more accuracy than in the past, and to help with balancing of knee and hip joints to a much higher degree than we used to be able to do. And I do think that this will make a significant difference in how patients will do and how their joints function. At this point, it's not possible to say what that importance is because it just hasn't been out long enough, but early studies showing the outcomes of robotic assisted surgery are very impressive so far. And so we've just, my group has just invested, and we just got one of these robots for our surgery center where we can perform what's called Makoplasty, and that's because the robot is called a Mako robot. And without getting too bogged down into the details, essentially the robot allows us to plan exactly where we want those pieces to go before we start operating, and it then allows us to remove just enough bone to facilitate that surgery and make it come out in the best possible way. That's what the arm of the robot looks like. It's important to point out the robot does not operate on people. I operate on people. The robot is just a tool, but it is a very effective tool, and it helps us both with knee and hip replacements. This is a cartoon depiction of how the robotic arm is used to help us during a hip replacement to place the pieces more accurately.